In our interview this week, the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaibu, speaks to us about the polio-free status that beckons on Nigeria. Dr. Shuaibu, Faisal, you're welcome to the program.
Thank you very much.
Well, what exactly does 3 years of wild polio virus-free nation mean for Nigeria at the moment?
It means a lot of things, but primarily it is a milestone that we've been waiting for the last 3 years. 3 consecutive years without a single child in Nigeria coming down with paralysis as a result of a perfectly preventable disease. But apart from that, it also kicks off the process of certification. That is to say, the process of documentation, process of data collection and analysis to ensure that there is no transmission of white polio virus anywhere within Nigeria. And in the end, it is a certification that will be done for each and every country in Africa. So the African Regional Office of the World Health Organization is responsible for this certification, and it will certify the whole of Africa as white polio virus free once the data and documentation is completed for Nigeria. So it is done concurrently with that of other countries.
I know we attained this feat in 2016. Actually, we were on the verge of being certified, and then something happened. What exactly?
Right. So in 2016, we had an outbreak of the white polio virus when we had gone almost 2 years without a single case. Now, this outbreak occurred because unknown to the program, in some of the security compromised areas of Borno State, especially around the Lake Chad region, there was still some transmission of white polio viruses going on there, right? So because of our very sensitive surveillance system, once some of the kids that were in previously inaccessible areas began to come to the more accessible areas, the surveillance system picked up the virus, and that is what led to the sort of resurgence of white polio virus detection. And we, of course, alerted the federal government that we had an outbreak. Mr. President immediately released 9.8 billion naira and directed the Federal Ministry of Health and the National Primary Healthcare Development Agency to mount an aggressive and rapid response to the outbreak. Because of the quality of that outbreak, because of the collaboration that existed and still exists to this day between government and the partnership, we've been able to deliver on the task of stopping the outbreak and ensuring that no circulation continues anywhere in the country. But the question you could possibly ask is, how can we be so sure that exactly the same thing will not happen, right?
I was just getting to that actually, because if we're on the verge and now again we're on the same page, how do you stop a reoccurrence? So
we learned from the past, right? One of the reasons why we felt sort of confident that we had done the job in 2014 to 2016 was because we had gone around every nook and cranny in Nigeria and provided oral polio vaccines and IPV, especially in the inaccessible areas, so inactivated polio vaccines, right? But we do believe that the outbreak actually came from the Lake Chad basin, right? There were a number of kids, almost 500,000 to 600,000 kids that were not reached by 2016.
Where?
In the northeast, particularly in Borno, right, in Borno State. And at that point, we still had a number of communities where access was a challenge due to insecurity. But in the course of the last 3 years, we've seen an improvement in the security in some of those areas. But we've also been wiser. We've developed innovative strategies to reach kids in previously inaccessible areas, right? So beyond vaccinations, we also treated for malaria, and then working with humanitarian organizations, we also provided humanitarian services, especially around nutrition. But in order to make sure that we did not miss any transmission, we also collected samples from the environment, from sewage, from kits that we randomly selected, right? If there's any transmission, we expect that we will pick this up from the environment or from randomly selected kits, right? So we've been very thorough and very robust in terms of our surveillance to make sure that this time around, we do get certified for sure.
So for 3 years, it was uninterrupted, or you had challenges which you found ways to surmount?
Absolutely, absolutely. So, of course, the biggest challenge in the Northeast has always been that of insecurity, right? Yes. And we've been collaborating with all our partners, including the military, around how we can give health packages to all community members, not focusing only on immunization, right? But all health services, especially in those vulnerable groups, the vulnerable women, vulnerable kids. And because we're taking these interventions as a package, we've been able to create more demand for health services. We believe that this contributed to a great deal in our ability to get to where we are today. But very importantly, of course, is that we've not been able to reach these communities if it weren't for the leadership provided by the traditional leaders.
State governments have made some sort of plans to begin to strengthen immunization, and this is another area, coupled with other challenges, inherent in primary healthcare centers. Is this feasible, or is this maybe just paying lip service to this entire thing?
So we cannot make progress towards universal health coverage where people everywhere have access to basic health care without strengthening primary health care.
Sure.
Strengthening primary health care and also strengthening our ability to pool risks, right, and provide insurance coverage for health. That is why we're working with the National Health Insurance Scheme to make sure that there are more people who are covered with insurance, and then we'll be able to strengthen primary health care. We've had a lot of engagement with governors, both returning governors and newly elected governors, and I can see the excitement that they have around how they can do a better job of providing primary health care to their people. I see the honesty, I see the integrity with which they talk about providing health for their service, and that gives me a lot of hope. The federal government has a policy of saying we'd like to see that in every ward, there's one functional primary healthcare center, right? And because we have almost 10,000 wards, that means we are targeting 10,000 primary healthcare centers that are functional. Having a functional primary healthcare center goes beyond putting paint and renovating it.
Yeah,
you need to have the human resources.
Yes.
Utilities have to be there, the drugs have to be there, the commodities have to be there, right? And you must have a plan to bring people into the primary healthcare centers, right? So this is not something that we are going to do only at national. It requires states to do it. It requires the local government areas to do it. So far,
yes,
almost 800 primary healthcare centers have been renovated, right?
Since 2015.
Since 2015, right? This is what we have done with our development partners and the states.
And we had an initial target of 10,000.
Well, the target of 10,000 is one per ward, right? But right now, we have about 4,000 primary healthcare centers that are functional, right? So in addition to what is already functional, we're targeting doing this, making this up to 10,000, right? It's not something that we ever said we're going to do within a year or 2 years.
No, nobody said within a year.
Yeah, so it's going to take time.
If it took 2015 to 2019 to achieve just close to 800,
right?
So in the next 4 years, we're still looking at under 2,000.
So this is why,
and which is way back from the target that Nigerians were promised.
Yes, absolutely. So this is why we have to also ensure that collaboration between the states and the LGAs. So the states have the mandate to provide these primary healthcare centers.
Thank you very much for your time.
Okay, thank you very much. Yeah, thank you so much. Yes.
Thank you.
Thanks.
Well, thanks for staying with us. We'd like to hear from residents of the nation's capital about what they are expecting from the Minister of the FCT. You can also comment on the state of primary health care centers in your area. Feel free to send us pictures of the facility in your area. Send us views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. You may watch any episode of the program on YouTube. Thank you for watching this week. I'm Gloria Umezike. See you again.